Hi, Dr. Mookie back with another foot message for you. I can't emphasize enough to you, the listener, and to my patients when I see them in a treatment room how critically important getting the right diagnosis is to getting to the root of the problem, especially something that's a little bit more advanced, a little bit more chronic, pain that's been around for a long time. Seen so many cases of people who have gone to other doctors, two, three, four different doctors, and they still didn't quite have the diagnosis. The person still had pain, and they come to me, and I ask a bunch of questions and figure out that they haven't even had an MRI, and the MRI is one of the best images you can have to diagnose a lot of conditions. I've seen that with arthritis in big toe joints. I've seen that with Achilles problems. I've seen it with plantar fasciitis problems. I've seen it with midfoot problems, so many different things. And there's times when the MRI shows absolutely nothing. Well, what does that mean? It means there's still something going on. There's something that needs to be addressed, but at least we know that there's not anything like a tear or a broken bone or something that we can't see on a regular x-ray. Getting the right diagnosis is really like it's mission critical. Like it's the first thing that we do, and when we're treating somebody, and sometimes doctors won't order an MRI because they're too expensive, and they're concerned about cost. And yes, they are covered by insurance in most cases, but nonetheless, we need to get the right diagnosis, and we don't run to that quickly. We try other things first, an x-ray, maybe an ultrasound, that type of thing, but sometimes an MRI is indicated. And if we don't find anything, that's great. If we do find something, then at least we know what we're dealing with. So if you've been suffering from something for a long time, and an MRI hasn't been done, and maybe you need to see me for that or whatever, the bottom line is we want to get the right diagnosis. And it's frustrating when we don't have the right diagnostics to make that diagnosis, and sometimes it's as easy as ordering an MRI. So hopefully that helps. And again, feel free to pass these along, and thank you for listening. We'll see you next time.